Millions of men around the world suffer from lower urinary tract symptoms due to benign prostatic hyperplasia, also known as BPH or an enlarged prostate. These symptoms can be extremely disruptive, ranging from frequent urination, weak stream, straining to start, or waking up multiple times during the night. Over time, they can significantly impact quality of life, sleep, and daily activities. For many years, the standard approach to treating BPH was to begin with medication, either alpha blockers or 5-alpha reductase inhibitors, and stay on those drugs until they stopped working or caused side effects. At that point, the next step was usually a surgery known as TURP, or transurethral resection of the prostate. While effective, TURP involves cutting away prostate tissue using heat, which comes with a higher risk of side effects, particularly related to sexual function. But things have changed. We've now entered a new era in BPH treatment, one where men don't have to choose between living with difficult symptoms or undergoing invasive surgery that can impact their sexual health. One of the most promising advances in this area is Aquablation therapy, a robotic, minimally invasive procedure that's been gaining ground worldwide. Aquablation is designed to deliver rapid, effective, and lasting relief from urinary symptoms caused by an enlarged prostate. What makes it so innovative is that it uses a high-velocity water jet, guided by robotic precision, to remove the obstructing prostate tissue. Unlike traditional surgeries, Aquablation uses no heat at all. That's one of its key advantages. By avoiding heat, it also avoids the kind of thermal damage that can impact nearby structures like the nerves responsible for sexual function. The procedure is done in the hospital under general anesthesia. It begins with real-time imaging. An ultrasound probe is placed into the rectum to create a detailed map of the prostate, while a small camera is inserted through the urethra to provide direct visualization from the inside. Using this dual imaging system, the surgeon can define the exact area of the prostate that needs to be treated, while sparing the portions responsible for ejaculation. One of those key areas is known as the verumontanum, and preserving it helps reduce the risk of ejaculatory dysfunction. Once the plan is set, the robot delivers a precisely targeted high-pressure water stream that removes the excess tissue quickly and cleanly. The entire process is automated and programmed, but monitored in real time by the surgeon. So the goal here is to relieve the obstruction in a way that really maximizes urinary flow, reduces symptoms like urgency or incomplete emptying, and, avoids unnecessary trauma to the surrounding tissue. After the procedure, a catheter is typically placed for a short time to assist with urination during recovery. Most patients actually go home within a day or two. Now let's talk about the outcomes. One of the largest and most important clinical studies evaluating aquablation is called the WATER study. This was a double-blind, randomized controlled trial that compared aquablation to the traditional TURP procedure in nearly 100 men. The results were, honestly, pretty impressive. Both groups improved, but those who underwent aquablation saw a greater reduction in their symptom scores. On average, their International Prostate Symptom Score, or IPSS, dropped by 14.1 points, compared to a 10.8-point reduction in the TURP group. The IPSS is a standardized questionnaire used to evaluate how severe urinary symptoms are and how much they improve after treatment. But symptom relief isn't the only measure of success. We also have to consider durability. After 5 years, men who had aquablation were less likely to need further treatment for BPH. About 13.2% of them required reintervention compared to 17.6% of men in the TURP group. And when we look specifically at the number of men who needed another surgery, the difference was even more noticeable. Only 1.6% of aquablation patients had a second operation versus 3.1% in the TURP group. This just goes to show that aquablation doesn't just work, it really lasts. One of the biggest concerns men have when considering treatment for BPH is the risk of sexual side effects. A lot of folks worry that surgery might interfere with erections or ejaculation, and honestly, this concern is valid. With TURP, for example, studies have shown that up to 20% of men can experience changes in erectile function. Even more concerning is the risk of retrograde ejaculation, where semen goes backward into the bladder instead of out through the penis. This actually occurs in around 80% of men after TURP. With aquablation, the numbers look very different. In the water study, no patients experienced new erectile dysfunction after the procedure, and when it comes to ejaculation, only about 15% reported changes, far lower than the rates seen with TURP. So what about men with larger prostates? A lot of minimally invasive procedures are only approved for small to medium-sized glands, but aquablation stands out here as well. A follow-up study called Water 2 included men with prostate volumes between 80 and 120 cubic centimeters. These are considered large prostates, which typically require more complex surgeries. Even in this group, aquablation delivered significant improvements in symptoms and strong durability. After 5 years, over 96% of those patients had not needed additional treatment, and only 3.7% had undergone another surgery. Aquablation has another important benefit. It's suitable for many different shapes and sizes of prostates. Some traditional procedures struggle with unusual anatomy, but aquablation's robotic guidance and non-thermal approach give it flexibility and precision across a wide range of cases. Because there's no heat involved, there's also no risk of thermal injury to the delicate erectile nerves that run alongside the prostate. That's one reason we see such low rates of erectile dysfunction in men who've had this treatment. However, the fact that it doesn't use heat can also present a challenge. Without thermal energy to help coagulate blood vessels, there can be a slightly increased risk of bleeding during or after surgery. That said, as surgeons gain more experience with aquablation and techniques continue to improve, this risk has become more manageable. So, overall, aquablation is an exciting and highly effective treatment option for men suffering from urinary symptoms related to BPH. It really offers the durability and symptom relief of traditional procedures like TURP, but with a much lower chance of sexual side effects. It's a forward-thinking approach that combines imaging, robotics, and water-based precision to deliver excellent outcomes. If you or someone you know is struggling with BPH, it may be time to consider whether aquablation could be the right choice. As always, a consultation with a qualified urologist is essential to evaluate your individual situation and determine the best path forward. If you've had experience with aquablation or you have questions about it, feel free to share your thoughts. Whether you're just beginning your journey or actively exploring your treatment options, you're not alone, and your story may help others make an informed decision. Thanks for watching, and take good care of your prostate.